In terms of back pain, I mean, when you were talking as well, I was thinking more like in terms of pain and how recovering from pain and healing from things like back pain isn't linear. And you do have flare-ups and downs. And if you looked at someone's recovery, it's like it's literally up and down on a graph. And some days are good, some days are bad. And sometimes there's no rhyme or reason. But if we can just, I don't know, bring it back to that intrinsic reward system and practice a bit of gratitude, go, okay, yeah, my back still hurts, but I was able to get down on the floor and move a bit better today, or I slept better and it felt better within my system. Yeah, I think that's really important. If you're just focusing on when am I going to get out of pain or when am I going to lose weight, it's not going to be a great feeling when you get there, I think.
Yeah, it's like I think with pain is that there's a lot more. It's like once you got there, it's like, yeah, this is amazing, you know. But it's definitely a case of how you got there as well, because if it's just pain medication, numbing yourself, all that kind of stuff, it's like, yeah, okay, you're out of pain, but that's no fun, you know.
Yeah,
so
exactly.
It's like, that's not going to feel great in that. Okay, I've got that relief. I feel great that I got the relief, but what are you doing to yourself to be able to attain that relief?
Yes.
And that is, you know, long term is damaging. It's not going to be effective for you. Whereas actually, you're working on the thing that is underlying all of that, and you're doing exactly what you said there as well. You're appreciating that you are actually moving better. You can get up and down off the floor better than you ever have done before, since you had the pain. And because oftentimes as well, better movement precedes reduction in pain.
Yes.
So you're like, if you're completely fixated on the pain has gone, it's like you can miss out on better, and which will lead to getting out of pain. So, yeah, you got to have that bigger picture, and showing that gratitude is a huge part of that intrinsic process as well.
Massively.
We're wired for more negative information making its way in to our psyche than for positive information. And, you know, like some estimates put out the ratio of 9 to 1. Absorb 9 bits of negative information for every 1 bit positive. So you have to do what you can to redress that balance. You have to make it more of an active process, and gratitude is excellent at that. And especially if you're suffering from pain, by showing gratitude for your body, like that's an important part. It's I would say for me, this is what I ask clients to do, just like actually show gratitude for your body.
Yeah, really good idea.
Yeah, because you hate it. You're like, it's in pain.
You're angry with it. Yeah.
You're angry with it. Yeah, angry, frustrated. You know, think about how that sits in your body. Does that make it feel any better? No, it doesn't.
Not really.
So if you actually show some appreciation for the fact that it's doing exactly what it's supposed to be doing in this moment, and appreciating whatever way you can, that helps anxiety as well. So when you're lowering your anxiety, you're lowering your sensitivity to pain as well, and realizing that there's more optimism. When you're more optimistic, you're able to handle pain better.
Absolutely.
So because it's not just a physical thing, it's a mental thing, and it's a subjective thing. So you're introducing a subjective protocol here, and that's helping you improve your pain symptoms. And because you build optimism and lower anxiety, it makes it easier for you feel more drive to do the exercises you need to do to get you out of pain. And then so it creates that positive feedback loop, and so the more you do it, the better things become. So absolutely, gratitude is a massively important part of not just a process to get a result, but just part of life, just to get
absolutely. And everything you just said, I mean, all of that, if we track that back to what I was talking about with energy levels, it's like all of that's going to help your body budget and conserve your energy levels. Like if you're less anxious, less stressed, you're going to have more body budget to do the things that you need to do. And then you're going to feel less pain. And then if you feel less pain, you're going to have more energy. So it's like this really nice circle of good. So yeah, that's what we want people to have, really.
Yeah, exactly. Just realize that just is there is a way out of it. A
Sure.
lot of people feel resigned to it. They can feel like, all right, well, I'm getting older. This is a part of getting older.
This is it. No, it doesn't have to be it.
Yeah, not at all. It's like
Absolutely.
you're not made to just hold on to pain. You're made to work your way through it. So when it comes to low back pain, it's like, okay, let's get those basics right. Because the basics have gone wrong, we're going to get them right. And we're talking about like chronic here as well. It's like if you're acute, i.e., you've actually got trauma, you just suffered from something. It's like, okay, well, let's let that settle down.
Yeah, that needs to dial down. Yeah.
And then let that physically repair. But usually within 3 to 6 months of that, you're all ready to really take on some rehab protocols. And so, yeah, it's like look at the bigger picture. Is like there's so many things you can do to help you improve the symptoms and help you improve your quality of life, so that you're not just getting rid of the pain, you're actually staying away from it as well. You're doing what you can to make sure it doesn't come back, and note on it coming back. Like at some point,
it will
get some sort of flare up. But the thing is, it's going to be like so much more manageable.
It's going to be manageable,
by having these tools. And at the end of the day, thinking that your life is going to be pain free it just doesn't happen. It's non-existent.
It's unrealistic. Yeah,
you're always going to experience it on some level. So it's just a matter of knowing what you can do for it, about it, and then be safe in the knowledge that you have the tools to deal with it.
Absolutely. And as a back pain sufferer myself, I know that there are moments where my back will flare up for no reason other than, I might be overstressed, anxious, or I haven't slept well. And because my back, I have a condition, I know that it is, I just have to manage it. Along with everything else, I have to manage that condition. And everything that we've just spoken about, that's what you have to do. You have to, have your base level of exercises that you always return to when you are in a flare up, and know that because you know how to manage that back pain, it will go. Generally, if there is inflammation there, it is going to go with gentle movement, and do keep moving. And even if it's tiny little movements, keeping moving with most back conditions is key. Than lying in bed and not doing anything or taking painkillers. As someone that has a fairly gnarly back condition, I can absolutely say hand on heart that just keep moving, even if it's gently, tiny, 5 minutes or a small walk. Anything that you can will definitely help. And and I know that there's always going to be moments where I'm in pain, and you just have to navigate through them. It's like I was talking last week about the idea around I don't think it's that I'm never going to get injured, but I know that I'm always going to recover. It's that same thing. It's like I know when I'm in a back flare that I will recover, and I'll use the tools and I'll use everything that I have to make that happen.
Yeah. And what is your gnarly condition?
So I have something called a spondylolisthesis, which it really simply is where one of the vertebrae, and usually they're in the lumbar spine, but they can be elsewhere, but a vertebra, so the actual bone in my lumbar spine, has slipped forward. So this sometimes gets confused with when people call disc herniations disc slips. They're not slip discs. An intervertebral disc, which is the disc in between the vertebra, doesn't slip. It prolapses, it herniates, so it protrudes through, but it doesn't slip. Like the actual vertebra slip, and that's what I have. So one of my lumbar spine segments has slipped forward, and so it almost creates, like, if you imagine like a drawer getting stuck within I don't know, a chest of drawers. If the drawer gets stuck, it's hinged and stuck. So I have to be really careful what movements I do. But I generally do most movements because I believe that we should, because functional movement, we have to be able to bend and extend our spine and move and rotate. I tend to do most movements, but I'm very, very careful. The pain it causes, I find it very hard to arch my spine back. It gets a bit stuck. It looks a bit frozen, a bit stuck, like I can't really move it. And yeah, it can just feel very stiff and achy around that area, and it just almost it changes my posture ever so slightly. I don't look like I've got a normal posture in that I haven't got much of a curve in my lumbar spine. It almost looks like that area is fused, but there is mobility there, and I do a lot of work around it, but I also know when not to push it. So there'll be certain exercises in class that I won't do, or I'll just say to my guys, you guys can probably do this more. I'm not going to do this today. So it is just working around the area, and most of the time it's fine. And I can do things like jiu-jitsu and Thai boxing, and I don't have any problems. But I know when to be careful and sit back and rest and take it down a notch, if you like.
Well, I'd say like it's a hell of a testament to how well you take care of yourself.
Yeah.
To be able to do intense sports like Brazilian Jiu-Jitsu, wrestling, and Thai boxing as well, because they can put a lot of shear through the back.
Huge strain, yeah.
Yeah, a lot of things that people struggle with in grappling is lower back pain. Just the amount of flexion extension the back can go through. So the fact that you're doing that is a massive testament to the quality of work that you've done to take care of yourself. Because there'll be so many people who are like, I've got spontaneous. There's no way I'm doing, and you're like, no, there is a way you can do it if you wanted to do it, and it's just a matter of building up that function around your spine so that you give yourself a chance.
It is. It's just it is learning those exercises that are going to keep you strong, but also trusting. And I think I read this the other day. It's like your spine is far stronger than you realize. I think people walk around thinking that our spines are these delicate, fragile things, but they're not. Our center of mass is based around our lumbar spine. Like, it has to be sturdy. And when I got that into my head a little while ago, a few years ago, it's like our spines are far more, they have more strength than we ever realized. And I just feel like I wanted to put myself through and see what I was capable of, especially with wrestling. It's a difficult sport in that respect, and you are sometimes being crushed or you're being pulled, and I wanted to see whether I could do it. And again, as long as I'm careful, I haven't got injured in that way. I might have got cauliflower ear and a bashed up tooth, but my spine has held out beautifully.
Yeah, exactly. Your spine is a lot stronger. People think crumbling, they feel like they're broken, feel like you're beyond repair.
You're not.
No
way.
With
the right rehab.
Designed to be really strong. Yeah.
With the right rehab program, you can absolutely make it a lot stronger.